4 months post-op from a lower face necklift, and I still have discoloration, left over from brushing. Any suggestions? Kenelog injections have reduced the lump, but now plastic surgeon used laser to treat the discoloration. I was told to do nothing to the area. Is that the best advice?
Thank you for your question. You submitted 2 photos of the area under your chin, and you state that 4 months after your facelift surgery that you are undergoing treatment, laser specifically, to help with pigmentation issues after your surgery. And you stated that also that Kenelog was injected by your doctor during this time frame. Well, I think that as far as you asking, are you doing the right thing, I can give you some ideas of how I would handle a situation like this in my practice. My background is I'm a board-certified cosmetic surgeon, certified by the American Board of Cosmetic Surgery, and a fellowship-trained oculofacial plastic surgeon. I am practiced in Manhattan and Long Island for over 20 years, and facelifts is a big part of my practice. So just to get to the treatment plan, we have to get to first what is likely to be the basis for why you need this treatment. When you look at the first photo and you look at this area, and it is clear that at some point during your healing process that some type of collection occurred under the chin. And when we describe these collections in medicine, we refer to it in there are several different categories. One is hematoma, or collection of blood after surgery. Another is called seroma, which is similar to hematoma, but it's actually more of what's called a straw-colored fluid that is related to inflammation and the leakage of fluid into the space. And last is something called induration, which is also based on a healing process where it can get kind of bumpy and irregular. Now, all these treatments, all these situations require some kind of intervention, and it seems like everything is going in a way that I think most of my colleagues would agree, where if you recognize there is some type of scarring, that's a common pathway here, is that with some degree of chronicity, meaning that after the first month or so, there may be, there's normal healing and there's normal resolution, and then there is persistent inflammation and what we call is organization of the tissue in a way that can form an undesirable scar. And when I say scar, I'm talking about tissue that is between the area that's operated and the skin. Now, this intervention of using a steroid like Kenelog is standard of care for any type of scarring situation. And for pigmentation, the use of lasers definitely has its place and has value. Where I would probably offer some alternative thought is that in my practice I have a lot of experience with something called platelet-rich plasma. Platelet-rich plasma is a topic or is a method that first was developed by oral surgeons to facilitate the healing for dental implant surgery. It was then further developed in orthopedics for their specialty to help with tendon and ligament and other types of tissue repair necessary in orthopedics. In our field, in cosmetic surgery, it has yet to be fully embraced because not enough doctors get trained in it in their primary training, nor is it very well understood because of that limited exposure. And what I've done in my practice is I've developed my own process and systems of using PRP, or platelet-rich plasma, because we use it a lot. In fact, we use it as part of one of our other areas of treatment, which we do a lot of hair loss treatment called trichostem hair regeneration. So as far as scarring is concerned, I've had a lot of success with the use of platelet-rich plasma for acne scars, for thickened scars or hypertrophic scars, for a lot of areas, wrinkles, fine lines, as well as under-eye dark circles. But for scar tissue, we've done a combination of platelet-rich plasma plus acellular matrix. We've also done platelet-rich plasma alone. Now, of course, all of this is being suggested, and it may not be the right time in your situation. It may be outside of the best window. You know, when in clinical medicine, we do treatment and we observe response. And I'm sure that's what your doctor has been doing, and so that's why you're on the path that you're on. I'm just offering this as a way to maybe not necessarily address scarring or pigmentation, for which platelet-rich plasma does have value and has literally is risk-free because of it's almost risk-free. In medicine, we never say risk-free. Because it's your own blood, and it's basically using your body's own healing factors. And in my hands, I've had a lot of success with it in the treatment of scar tissue. I think that there's also value in terms of rehabilitation of soft tissue, because platelet-rich plasma has a unique quality in that what it does is it stimulates blood supply, it stimulates new collagen formation, and it seems to have an effect on the collagen remodeling process. And if anyone questions the value of platelet-rich plasma, all they have to do is go on the PubMed or the National Library of Medicine index of articles written about platelet-rich plasma, and there are hundreds and hundreds of articles demonstrating the benefits and the quality of results using platelet-rich plasma in a variety of instances. When I see patients who have had previous surgery, particularly for like eyelid retraction or complications or facelift scarring, etc., I find that even if I'm going to plan to do some type of surgical procedure, I will use platelet-rich plasma as a way to rehabilitate the tissue, as I described before, stimulating blood supply, improving the vascularity and the quality of the tissue is always a good thing, and it allows for a more successful surgical revision plan. When you think about it, when people use steroids or antimetabolites, there is still some collateral tissue loss when used beyond the path of the scar, and even if it's within the scar, you can get adjacent skin and soft tissue atrophy. When you think about platelet-rich plasma, this is some way to mitigate that, and it can have some value. Again, without the benefit of a physical examination, it's very difficult to offer more meaningful, definitive recommendations, but certainly from my perspective, your doctor is on the right track. So you may want to have a discussion with your doctor about platelet-rich plasma as an option. So I hope that was helpful. I wish you the best of luck. Thank you for your question.